Edutainment Studios welcomes you to Parkinson's Disease, Understanding It. This module is part 1 of a 5-part series on Parkinson's disease. Parkinson's disease, or PD, can be challenging to live with due to the fact that it causes progressive changes to the body's motor function skills, as well as many other non-motor areas, which can include bouts of depression, sleeping problems, pain, and cognitive dysfunction. This disease greatly impacts the quality of life in both yourself as well as your caregiver. Although a lot of factors of Parkinson's disease are uncontrollable, actively pursuing all of the treatment options that are available can provide you with a sense of control and help you live your life to the fullest. In this course, the objective is to help you to be able to state the basic information about Parkinson's disease and explain how it is diagnosed. Parkinson's disease is a chronic, degenerative neurological disorder that affects 1 in 100 people over the age of 60. While the average age at onset is 60, some cases have been diagnosed as early as 18 years of age. There is no objective test or biomarker for PD, so the rate of misdiagnosis can be relatively high, especially when the diagnosis is made by a non-specialist. Due to this, we can only estimate the number of people living with this disease, but recent research indicates that there are at least 1 million people in the United States and 5 to 10 million people worldwide who have PD. Parkinson's disease was first characterized extensively by an English doctor, James Parkinson, in 1817. Today, we understand it to be a disorder of the central nervous system that results from the loss of cells in the substantia nigra area of the brain. Normal nerve cells in this area produce a chemical called dopamine, which is responsible for transmitting signals within the brain that control movement. Loss of dopamine causes neurons to fire without normal control, leaving you less able to direct or control your movement. Parkinson's disease is one of several diseases categorized by clinicians as a movement disorder. The cause of Parkinson's disease is still unknown, but it is known to begin in the brain cells. There is additional evidence suggesting that there may be some role of genetics, environmental factors, or even a combination of both. There is also a possibility that there may be more than one cause of this disease. There has been a number of rare instances where Parkinson's disease appeared to have been caused by a single genetic mutation. In these cases, the mutated gene was passed down from generation to generation. This resulted in a large number of Parkinson's disease cases within an extended family. Being exposed to certain toxins or environmental factors might also increase the risk of PD. There was a group of heroin users in California that took drugs which were contaminated with a substance called MPTP. After they ingested this chemical, the drug users were afflicted with a form of Parkinson's disease that was, in fact, environmental related. For most people with PD, the cause of this disease lies somewhere in the middle of genetics and environment. While there are many who report one or more family members with the disease, it is not always clear what gene or genes are the cause. Some suspect that being exposed to certain chemicals or environmental toxins cause the PD, but this cannot be conclusively proven. Currently, it is believed that in the majority of cases, genetic and environmental factors interact with each other to cause the disease. Aggressive research is continuing every day, but at this time, it seems impossible to determine what specifically causes an individual's Parkinson's disease. Parkinson's disease presents with many symptoms that include resting tremors, bradykinesia, which is slowness of movement, and rigidity. These symptoms will appear gradually, increase in severity over time, and will usually begin on one side of the body, then migrate to the other. If you are experiencing any of these symptoms, you may want to seek out the help of your primary physician or a neurologist. As of yet, there is no test to make a definitive diagnosis of PD. Instead, the doctor will take a complete medical history and perform a thorough neurological examination. The doctor will look for 2 or more of the particular cardinal signs to be present. Prescription medications used to treat PD may also be prescribed, and your body's response will be monitored as further evidence of having the disease. The Food and Drug Administration has recently approved a specialized imaging technique called DAT scan. This scan allows the doctors to capture detailed pictures of the dopamine system in the brain. The DAT scan alone cannot diagnose Parkinson's disease, but it can help confirm a physician's clinical diagnosis. Unfortunately, the fact that there is no definitive test for Parkinson's disease, and because PD symptoms are very similar to those of other neurological conditions, the misdiagnosis rate remains fairly high. Your doctor may recommend that you consider getting a second opinion with a neurologist who has expertise in movement disorders. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for Part 1 of Parkinson's disease, and join us for Part 2.